Our immune system is our body's defender, protecting us from diseases and infections. But what happens when our own immune system turns against us? This is what happens with autoimmune disorders, where the body's immune system mistakenly attacks its own tissues. In this video, we will cover rheumatoid arthritis. Rheumatoid arthritis, or RA, is a chronic autoimmune disorder where the immune system produces chemicals called cytokines and antibodies that targets its own tissues, focusing primarily on the joints. In RA, the cytokines cause inflammation in the synovium or lining of the joints, leading to pain, swelling, and redness, which over time causes damage to cartilage and bone. This leads to joint deformities and loss of function. RA can also affect the eyes, skin, heart, and lungs due to widespread inflammation. Though RA is chronic, it can be managed with medications that suppress the immune response, alongside physical therapy and healthy lifestyle choices. Let's take a closer look at some medications used for treating RA. We begin with non-steroidal anti-inflammatory drugs, or NSAIDs. NSAIDs target enzymes known as COX-1 and COX-2. These enzymes play an important role in producing prostaglandins, which signal pain, fever, and inflammation. By blocking these enzymes, NSAIDs turn off the distress signals, alleviating pain and reducing inflammation. Corticosteroids mimic the body's own anti-inflammatory hormones, which results in suppression of the immune system. They enter the immune system cells and block the transcription of DNA into messages that produce inflammatory proteins. This results in a decrease in the immune system's inflammatory response. Disease-modifying anti-rheumatic drugs, or DMARDs, target the disease at its roots. Methotrexate, a cornerstone of RA treatment, disrupts the metabolism of folic acid, which promotes cell growth. This interference slows down the immune system cells responsible for attacking joint tissues. Methotrexate also promotes the release of anti-inflammatory substances. Biologic response modifiers zero in on specific targets within the immune system. TNF inhibitors block tumor necrosis factor. TNF is a cytokine that produces inflammation and fever. IL-6 is also a cytokine that promotes inflammation. IL-6 inhibitors target and interfere with the interleukin-6 pathway. By disrupting these pathways, biologics prevent the immune system from attacking joint tissues, reducing inflammation and halting disease progression. Janus kinase inhibitors, the newest medications for RA, work by blocking the Janus kinase pathways inside cells. These pathways signal the immune system to initiate inflammation. By inhibiting these enzymes, JAK inhibitors cut off the communication lines that trigger inflammation. Each medication used for treating RA works to inhibit the inflammatory response to help restore balance to the immune system and increase the quality of life for RA patients. I sincerely hope that you have learned about RA, and see you next time.